and also address your questions. With us today, we have the Executive Vice Mayor of Shanghai, Mr. Wu Qing, Madame Wu Qianyu from the Municipal Health Commission, Deputy Head of Municipal Commerce Bureau, Ms. Zhou Lan, the Chief Engineer of Municipal Economic and Information Commission, Zhang Hongtao, and Head of the Municipal Clinical Laboratory Center, Hu Xiaobo. First, I would like to give the floor to Wu Qing to brief us the latest situation. Friends from the media, good morning. And right now, I would like to give you an update on the nucleic acid testing in Shanghai. Since the outbreak of this round of epidemic, with the support of the Joint Prevention Control Mechanism, we have organized several rounds of nucleic acid testing. In order to do a good job in the NAT, we have mobilized forces from different sectors, and also we organized task force to roll out the nucleic acid testing. In different districts, they also organize special teams to facilitate with their work. So we have to identify the infected cases as soon as possible so as to curb the spread of the virus. And this will help us to identify the cases as early as possible and bring all of these infected cases into quarantine. With the support of the local residents, start from April the 15th, we have already rolled out the test to over 37 million people, and we will continue our efforts on the citywide testing, especially in the lockdown area. By 20th of this month, we also roll out the nucleic acid testing in the restricted area and the lockdown area. So we have to focus on the epidemiological investigations, and also we will analyze the results, and then we will divide 3 areas: the lockdown areas, the restricted areas, and the control area. We will focus on the antigen testing plus the nucleic acid testing. We have to improve our efficiency in the NAT so that we can bring all of these patients to hospital for treatment. On top of that, we have to further allocate sufficient resources to support the sample collection. We work with the local communities to set up the NAT sites, and we also mobilize the volunteers to facilitate the work. We have to make sure that for all the people who need to be tested, could be tested. And also we will allocate people in different districts and also different compounds and buildings to do the NAT work. At the same time, we have to guide the local residents so that they could exercise a 2-meter social distance. They have to wear this mask and they don't talk to each other during the process. So as for the resources, we have a blanket search. We have to identify the total population to receive the nucleic acid testing. We have to allocate our resources on a reasonable manner. So yesterday, we have allocated over 25,000 medics to support the nucleic acid testing. Among those 25,000 people, half of them are coming from our neighboring cities and the provinces. Because of their strong support, as well as the support from the grassroots forces, now we are able to roll out this large-scale nucleic acid testing. So for the sample collection, we will set up several mobile devices, mobile facilities to collect the samples so that we can increase the capacity for the nucleic acid testing. And also we are receiving a lot of support from other provinces. They also set up the laboratory to analyze the samples. So right now the daily capacity is about 5 million samples. And also we have over 200 vehicles to transport all of these samples. And at the same time, we are making good use of the information technology so as to better coordinate the resources in different parts of Shanghai. Third, after we end each round of the sample collection, we will step up efforts for the sample analysis and the testing. As we could see, the situation is evolving quickly, and the situation is quite complicated. We keep streamlining our processes in the sample collection and the testing. This may bring some inconveniences to the local residents and the volunteers. We will continue to improve our work and to educate the public about our plan so as to improve the efficiency on the screening. In order to better set up the next stage plan, each day we will report the results of the NAT screening. After we collect all the samples and the results, we will have experts to analyze all of the results so that we can divide different regions by level of risks. And then we can better divide the lockdown area, the restricted areas, and the control area. And actually today we have made some adjustments of those regions. By doing that, we can roll out the targeting measures in different regions. By taking this opportunity, I would like to call on all the residents to cooperate with us so that we can adhere to the dynamic zero COVID policy and resume our work and life. Thank you for Mr. Wu Qing's introduction. Now I would like to turn over to Madame Wu Qianyu to give us an update on the current situation. On April the 18th, Shanghai reported 3,084 new cases, including 977 asymptomatic cases who turned into the confirmed cases. Also, we found 17,332 asymptomatic cases. So yesterday, we reported a total 90,432 positive cases. So among the 3,084 confirmed cases, 216 found from the NAT screening of the risky population, over 1,000 found in the case with closed-loop management, and 974 were those who were asymptomatic cases. And also among all of these asymptomatic cases, over 10,000 people found in the areas with closed-loop management, 334 people found from the NAT screening of the risky population. As of yesterday, the designated hospital received 21 severe cases. So on April the 18th, 7 new death cases reported aging from 60 to 101 years old, and these people, they are suffering from the complication of the underlying disease, including coronary heart disease, diabetes, hypertension, etc. All of these people, they haven't received any doses of the vaccination. For these 7 people, after they enter into the hospital, their situation getting worse, and the root cause for their death is their underlying disease. So as of 9 o'clock today, a total of 350,000 close contacts have been identified in the city, and over 271,000 people tested negative. Yesterday, 1,211 people discharged from the hospital and over 22,000 asymptomatic cases have been removed from the quarantine and returned to their residence for further observation. So now you could see yesterday we have more people discharged from the hospital compared to the confirmed cases. And we have more people who have been removed from the quarantine or discharged from the hospital. And today, in our official account, we will release an e-book. So this is a knowledge-sharing book about the COVID-19. So for this guideline, it covers a wide range of topics. For example, there may be some basic knowledge about personal protection, vaccination, health management, altogether 100 Q&A notes in the COVID-19 guidelines. So for the local residents, they could download this electronic guideline to better understand the situation. That is my update today. Now the floor is open for questions. So the journalist from line 1. With People's Daily. My question is to Mr. Wu. So I think at this stage, many people require nucleic acid testing. For example, for people who need to provide supplies, they have to receive nucleic acid testing. After resume their work and production, more and more people need to get tested. So is there any plan to adding more NAT facilities? Thank you. Thank you for your question. And right now, we are actually working on this issue. With several rounds of consultation, we have made some further plans. So first, we will look at the density of the population in different districts, and then we can better allocate the NAT sites. So we have some permanent NAT sites, and also we have some community sites, and also the mobile NAT sites. So for those permanent facilities, we have around 200 medical institutions which could offer the nucleic acid testing services. And also we have set up many booths to collect the samples from the residents. Also, we have built some of the makeshift sample collection sites to facilitate with the NAT requirements, so we could respond rapidly to the needs of our people. As we set up all of these facilities, most of them are actually located in the communities or some transportation sites. For example, the high-speed train station or bus terminals. And also we will set up some of the sample collection sites in supermarkets, schools, drugstores, or construction sites, etc. Because in those areas, we do see these places are intensely populated. However, we need to find a spacious place to set up all of those facilities. So right now, we are responding to those people who need to receive the test, especially for those who have to provide supplies to our people. And also, we have to make sure we respond to the needs of our people. For example, we have to bring all these people for nucleic acid testing when required. And all of these will be the guideline for us to set up all of these NAT facilities. Thank you. Next question, please. line 17. With the paper, in the past 2 days, we are seeing that for some of the supermarkets reopened, and my question is about the number of delivery guys. So I want the public attach great importance to the NAT situation for the delivery guys. Can you tell us more about this? Well, actually, for the courierman and the delivery guy, they're the important section to ensure the supplies of the city. So right now we have over 20,000 delivery guys working in different sectors in Shanghai. And right now the total capacity is about like 2.2 million orders, 10 times higher than that of last week. So I believe many people attach great importance to the health condition of those delivery guys. In order to ensure a safe delivery, we will work with the post service, and also we are setting up a white list for the delivery guy and the companies. So for some of the enterprises, if they meet the requirement, they will be included into the white list. And start from today, we will try to verify the health condition of all the delivery guides. And this is an upgraded version of the health code. So we will make good use of the big data from the municipal government. We will look at the white list of the companies and the personnel, and also we will issue the e-pass to all of the delivery guides so that they can present their health code and also a negative NAT report. So all of these are valid certificates for all of these delivery guides. For different districts, they also have to ensure that they can provide services to this service personnel. And we will open up the green channel to provide the nucleic acid testing to those delivery guys. Thank you. Thank you. Next question, please. The journalist from line 2. With CMG. So for this round of epidemic, it is not just affecting Shanghai, but also affecting in the Yellow River Basin and the Yangtze River Basin. So I would like to understand what are some of the support that we have been receiving from our neighboring cities and the provinces. So thank you for your question and also your attention to this issue. So I will give you a general introduction about the situation of the support we have received. So since the outbreak of this round of the epidemic, we have received a lot of support from the provinces from the Yangtze River Delta, and they stand side by side with the 25 million Shanghai residents. So in terms of the medical support and the daily necessity supplies, they have provided very important and also very immediate help to the Shanghai city. So by taking this opportunity on behalf of the Shanghai people, I would like to express my gratitude to those who have offered a helping hand from the Yangtze River Delta. So as for the medical resources, altogether 17 provinces have sent out over 26,000 people to provide the medical services in the makeshift hospital. And also for the 3 provinces from our neighboring provinces, they also help to provide medical services in the makeshift hospital, and also they have sent out over 100,000 people to offer the nucleic acid testing. And also for some of the neighboring provinces, they also organized a team to transport the samples of the nucleic acid testing. As for the daily necessities supplies, so for the provinces from the Yangtze River Delta, they also help us to construct the makeshift hospital, and also they are facilitating the transportation of the daily necessities. They have played a key role in the fight against COVID-19. At the same time, they're helping us to produce more anti-epidemic supplies. And also, I would like to emphasize for the neighboring provinces, they actually come up with a number of measures. For example, in Suzhou, they have set up a green channel for the transportation with the support of the Zhejiang province. In Kunshan, they actually established an emergency warehouse to offer the daily supplies to people who are living in Shanghai. They also issued the pass to the drivers so that they could travel between different places. In order to stabilize the supply chain, for key regions from the Yangtze River Delta, they have established special task force, and also they respond to the needs of the Shanghai people, and also they are offering the raw materials and the key units to make sure that for some of the key enterprises could sustain their operation during the epidemic period. In Suzhou and Taizhou, they also issue a green channel and a special pass. So for some of the key parts and the units can be transported to Shanghai so that some of the key enterprises, they could resume production and work. And actually there are many examples for the support of these neighboring provinces. And recently, Shanghai has released the first edition of the guideline on the work production, and especially we have formulated a white list to facilitate the transportation between different provinces and the cities. By doing all of that, we could make sure that the supply chain could remain stable, so that the industrial train could be sustained in the Yangtze River Delta. Once again, I would like to thank you for your question. Next question, please. The journalist from line 7. With Economic Daily, my question is to Mr. Zhang Hongtao, and just now we are talking about the work production. So we have released a guideline. So what are some of the considerations behind the formulation of this guideline? Thank you. So thank you for your question. Start from late March. So right now we have, since then, we have over 1,000 enterprises. They have suspended their business, including the energy, chemical supplies, and the pharmaceutical industries, etc. And for some of these workers, they have been staying in their enterprises for over 1 month. They've made their contribution in the stabilizing the supply chain. In view of the current situation, and also we are abiding by the regulation of the municipal government. For some of the key enterprises, we are trying to resume the production and work for some of these companies. And Shanghai has played a key role in stabilizing the supply chain. For example, we always pay a lot of attention of the production and the manufacturing of the automobiles. And this time, we are receiving a lot of support from our neighboring provinces. So we have taken two situations into consideration. First, we have to make sure that we have a very good control measures, because right now the epidemic is still at a critical stage. In order to resume the work and production, we need to have a very stringent prevention and control measures, because we have to be accountable for the production and also accountable for the safety of our employees. So right now, for some of their workers, they stay in the enterprises and they never stop their work. So for the details, actually, we already published on our official website. And this also caused a lot of attention from the public. For different enterprises, as they differ in their size, and also the space for the enterprises is quite different. And also they are located in different districts with different risk levels. However, all the enterprises will abide by the general guidelines. For example, for all the factories, they have to divide their factories in different sectors. And also, the production have to be taken different standards by different level of risks. We have to make sure that we could reduce the population flow in different production sections in the company. And also we have to increase the frequency of nucleic acid testing to some of the high-risk group of the workers. And also, for some of the new employees that are coming into the factory, we have to make sure that they're staying in different places so as to reduce the transmission of the virus. And also, we have to make sure that the factory can be divided into several parts to prevent the transmission of the virus. And also, we called on different sectors to support the work resumption. So it is not just focusing on the local government, and also we need people from Shanghai to support the enterprises. But of course, we have to come up with a customized plan to resume the production, especially for the safe production. And also, I believe for the society and for the local government, they have to come up with a number of measures to support the work resumption of the enterprises. I believe in different industries, they may face a different situation. But this is a dynamic work. We have to consider the situation of the epidemic. However, we may have some common problems, common issues, for example, the logistics, and also the people coming back to their position, etc. For some of the enterprises, for example, for some of their employees, they may be located in the control areas. So maybe these people are able to go back to their work position. But some of the employees, if they're staying in the lockdown area, so they may not able to come back to the factory. If that is the case, for these factories, they have to come up with a flexible schedule, also flexible arrangement to deal with the situation. And also we have to consider the situation of the logistics, etc. There's a lot of coordination need to be done. I believe in the future, with the change of the epidemic situation, I believe for all of these enterprises, they will react swiftly in accordance of the general guideline released by the municipal government. Because this time we could see we are receiving a lot of help from our neighboring cities and neighboring provinces. I believe with the joint efforts, the work resumption will occur soon. Any more questions? I would like to invite the journalist from line 21 to ask the question. Thank you. So in the past few days, there were many nucleic acid testing happened for the lockdown area. Is it necessary to roll out the repetitive nucleic acid testing in the lockdown area. Yes, indeed, right now it seems like we are doing the nucleic acid testing every day. But actually, we are fully considering the epidemiological studies. So after the virus enters into the body of human beings, there may be a long period of incubation of the virus. During the incubation, at that time, the viral load is quite low. So when we are collecting the samples, maybe we are not able to get sufficient samples of virus. At that time, the results may show negative. After the virus duplicated inside of the body, when it reached to a certain load, the viral load will increase in the samples we collected. And by that time, a positive result will manifest it. Of course, for different individuals, the incubation time may be different. And also from different people, they have different immunity system. So from the sample collection to the testing, I believe there may also be many factors affecting the results of the NAT. In the communities, it seems like every day we roll out the nucleic acid testing to the local residents. For each round of the NAT, for people who have a higher viral load, these people can be screened and be identified as infected cases. However, for some people, their viral load is quite low, and we are not able to identify this group of suspected cases. However, after a short period of time, as the virus continue to duplicate and the number of viral load will be increased, at that time, these people will be tested positive in the future. If we are not able to identify this group of people who seem to have a low viral load at the beginning, and these people will form a silent transmission route in the community. So my answer is, yes, we need to roll out several rounds of nucleic acid testing so that we could identify the positive cases in a dynamic manner, so that we could achieve the goal of zero transmission in communities outside quarantine. If there's no questions, that is the end of the Q&A. If you have more needs, make sure that you reach out to the Shanghai Municipal Government and also the Health Commission. That's the end of today's press conference. Thank you.